Hi everyone, my name is Leslie Castillo and today I will be presenting on leukemia. During this presentation, I'll explain what leukemia is, what causes it, who is most at risk, how it affects the lymphatic system, common signs, symptoms, diagnosis, treatments, and how artificial intelligence is improving diagnosis. What is leukemia? Leukemia is a cancer found in blood and bone marrow. Bone marrow is where blood cells are made. It normally produces healthy red blood cells, white blood cells, and platelets. Leukemia has an abnormal white blood cell production. These cells do not function correctly and overcrowd healthy blood cells. Etiology: genetics, environmental, and behavioral risk. The exact cause of leukemia is often unknown. Most cases result from genetic mutations acquired during life rather than inherited. Environmental exposures such as radiation, chemical exposures can damage DNA in blood-forming cells, causing an increase of cancer development. Additionally, environmental exposures can damage bone marrow cells. Behavioral risk. Unlike other types of cancers, leukemia does not have a lifestyle-related cause to the disease. Some behaviors may be smoking tobacco, working in high chemical workspaces, alcohol consumption, typically increase risk, especially for acute myeloid leukemia. Demographics. Who is most likely to develop leukemia? Leukemia affects different age groups depending on the type. Acute lymphocytic leukemia, also known as ALL, grows quickly and mainly affects children and young adults. Acute myelogenous leukemia, AML, also grows quickly but it most common affects adults over the age of 65 years old. Chronic lymphocytic leukemia, CLL, develops slowly and usually affects older adults. Chronic myelogenous leukemia, CML, develops slowly and mainly affects adults. Leukemia is also more common in males and people with genetic disorders such as Down syndrome. Rates differ worldwide because of age, genetics, healthcare access, and population size. In the United States, leukemia represents 3.2% of new cases to an older population and improved diagnosis. China reports more cases because of its large population. Many African countries report fewer cases partly because of younger population and have limited diagnostics resources. Anatomy. Leukemia begins in the bone marrow. Abnormal cells enter the bloodstream and then they spread to the lymph nodes where swelling often occurs. They continue through the lymphatic vessels, accumulate in the spleen, causing enlargement. And in some lymphocytic leukemias, may also involve the thymus. This spread weakens the immune system and normal blood cell production. Physiology and symptoms. How is the normal physiology of organs and tissues disrupted? Leukemia disrupts the normal physiology of blood-forming organs and tissues to the abnormal production of white blood cells. Because healthy blood cells decrease, patients develop anemia, causing fatigue and weakness. They experience frequent infections because abnormal white blood cells cannot fight off germs effectively. Other symptoms include fever, chills, weight loss, loss of appetite, swollen lymph nodes, liver, or spleen. What are the consequences of not treating the disease leukemia? Without treatment, leukemia cells continue multiplying. Healthy blood cells become sicker, leading to severe infections, bleeding, organ damage, and eventually death. Early diagnosis and treatments have greatly improved survival, although outcomes depend on the leukemia type. Diagnosis and treatments. Diagnosis performed by doctors typically include physical exams, testing of the bone marrow, bone marrow biopsies, imaging studies such as CT scans, MRIs. The bone marrow biopsy confirms the diagnosis because it directly shows the leukemia cells. Medical care and artificial intelligence. Treatments depend on age, leukemia type, and overall health. Options include chemotherapy, immunotherapy, targeted medicines, blood transfusions, and bone marrow or stem cell transplants. Artificial intelligence can analyze blood smears images rapidly and identify abnormal cells earlier, which helps healthcare providers such as doctors and nurses to diagnose leukemia sooner and begin treatments faster. These references included trusted medical organizations such as National Cancer Institute, Cleveland Clinic, Stanford Healthcare, and the American Society of Hematology. Thank you guys so much for viewing my video.